Imagine you or someone you know has a mental health emergency. There's a good chance the police will be called. Last year, APD's crisis intervention team responded to more than 12,000 calls.
Generally speaking, law enforcement over the years traditionally only had a few options, whether it was taking somebody directly to a psychiatric hospital or to jail if they had broken the law, or just leaving them in the community without any sort of resources.
Without community resources, jails and prisons are often left picking up the slack, making them the largest mental health care provider in many parts of the state. Just under 25% of Texas inmates suffer from mental illness.
Oftentimes when people experience a mental health crisis, they don't need to go to a hospital. They don't need to go to an emergency department. They certainly don't need to go to jail in order to resolve that crisis.
Now officers have another option: the new Judge Guy Herman Center in South Austin.
We've been blessed as a police department and a community to have another option for community members who are in a crisis to be placed into a productive crisis treatment setting.
Think of it as a kind of mental health emergency room. Whether you check yourself in or an officer brings you in, a couple of things are going to happen.
What they can first expect to do is to see one of our psychiatric nurses. The nurse then does a brief screening. While a person is here, they can expect to receive tailored case management to their needs, whether that's medical needs, psychiatric needs, social needs. Usually for everyone, it's a combination of all of those three. The average length of stay at the Judge Guy Herman Center is 3 to 5 days. Before a person leaves the Herman Center, they can expect that every effort has been made to link them to an ongoing treatment.
What is my official title? Well, no, because we've gone through several different versions of...
And the next guy you meet, the guy making sure you're getting the help that you need, might be Gus.
My name is Gustavo Rodriguez, and I'm an LPC, and our title is Expandable Crisis Outreach Team Clinician. Our team actually does two different things. We do both emergent, which is where we're responding to pages from our community partners, APD, Trust Sheriff, or EMS, and then there are routine days where we're going just doing the follow-up visits for all the people we've always seen. One of the big things we always had problems with was getting people to do follow-up, getting people to get the help that they needed after they saw the clinician.
So what happened when you first saw this person when they had their crisis?
Okay. Yeah, the person we're going to go out see, we actually first met them after a family disturbance.
Gus is often joined by students from the Dell Medical School. They get field experience and a better understanding of how to handle mental health emergencies.
It was mostly follow-up visits with people who had had prior crises and basically just seeing how they're doing, if they need other connections to other resources, which is pretty awesome to see the system actually work.
Item number 4 is APD response to mental health-related incidents.
And again, it's a system that often begins with police officers.
Since 2008, APD reported a 95% increase in mental health-related calls.
A recent city audit found that Austin has a high rate of fatal police shootings involving people dealing with mental health issues. It also revealed that dispatchers don't always send mental health officers to emergencies, but APD Police Chief Brian Manley says fixes are already underway.
We have already changed our policy, and policy now will call for a mental health officer to be immediately dispatched to those calls where we believe that it is at issue.
It's not a perfect system, but it is a start towards making sure mental health care extends past the emergency.